tonight. So I'm going to turn it over. Alan Jones.
Hello.
Alan Jones is not here. There you go. Okay. And so Anne Marie Soriano, our executive director, will take over for Alan. Anne Marie?
Okay, thank you. In July 25th, actually, you proposed a budget and approved a budget that came to a 0.9405 millage rate. That would, if that continues, that would produce a roughly $16,300,000, a little more than that. Some of that would create an 11.37% millage rate over the rolled back rate. The rolled back rate is the rate that you would assess to receive the same amount of taxes in a year that has an increased property tax value as we have this year. The property tax value of the gross value of the county increased by $1,100,000,000, a little more than that, this year. So and this year's tax rate is producing $14,400,000, almost $500,000. So your 0.9405 millage rate would produce $16,300,000. So almost $2 million more is what you would be proposing to spend at a millage rate of 0.9405. Some of the reasons for that increase for this year is if we were to pay in the next year at the same rate we're paying the hospital, there was an increased volume that was experienced this year at the hospital, so that's why they requested that amount. There were 3 new requests for new programs throughout our county that we didn't have in our budget last year. Even though we are reducing the amount of reserve that you put aside for the partnership program and not proposing to spend that exact amount next year, the increases that were proposed were $1,600,000. So that is what drove that millage rate over. There's roughly $2 million, as I just said, in increased property value that would be attained at the same rolled back rate, which would be 0.8445 if you were to approve that tax rate. So those are the reasons that the ad valorem tax the proposed increase is being proposed at the rate we did in July. So because this is a public budget hearing, we need to ask for public comment or listen to trustee comment before we move on to what we might propose tonight.
Okay. Should we do
Yeah.
trustee comment first, right?
Yes.
So, yes, trustee comments on the 9-4, right?
Right, on the 9-4 that we proposed in July.
July.
That is not the proposal for tonight. I'll get to that.
I'll say something, if that's okay.
Yes.
Probably not expected either. And I wrote this out because I wanted to be very specific in how I did this. And I'm saying due to the property tax value that, Anne Marie just spoke about, the property value increases for the hospital district are approximately $900,000 in extra revenue without raising the rates at all. Due to the end of the partnership process, the hospital district is going to have a cost savings of approximately $750,000. As a steward of taxpayer money, I cannot agree to a tax rate increase. With an extra $1,650,000, I'm not for increased taxes and spending. So that's my statement.
Okay.
You have any specific items that you're interested in? Because I know I have 1 or 2 items on the budget that I think we should discuss.
Well, we're not there yet, but
We're not
We're not getting into that yet?
quite
Oh.
yet.
Okay, because
Okay.
I think the budget still has a way to go when it comes to, I'd like to get it decreased.
We need to get to the current proposal first. We're looking at the July proposal.
what you already proposed in July.
Okay, well,
Which was, can you repeat that millage rate again, Anne Marie? That was,
0.9405 is what you approved in July. Is there any
So is there any public
Public.
comment
on that July proposal?
on the July proposal? Okay.
Okay. So we have met subsequently a couple of different times, this board has, you have met, and have discussed a few of the items. And on August 29th, you made some reductions in some of the line items to the budget. I have made those corrections, distributed those to you, and the proposal as it sits in front of you tonight with those reductions would assess a millage rate of 0.9122. So that is what would be proposed tonight. I don't know if you want me to talk about which ones you went down line item by line item, or if you're comfortable with what you've seen that I've distributed.
I think for the benefit of the community, we need to hear the line items that we reduced at the last chairman's meeting.
Okay. We took away the $100,000, which was earmarked for the incentive for the Partners Program. That is the metrics incentive that we have been paying over the last couple of years, but with the change, we decided that, you all decided that that was probably not necessary for the coming year. We also reduced the medication allotment to the University of Florida from the 90, let me see if I get that one right, 50,000, from down to $50,000. Kept that the same. We took away the $4,123 that was requested for the Gifford Health Center Pediatric Clinic, with the understanding that we increased our reserve fund by a little over $500,000, knowing that we're going to ramp up services at the Gifford Health Center, and so that pediatric portion would be included in that increase to the increased services at the Gifford Health Center. So it looks like a reduction in your programs, but that was, and then we reduced the amount to the professional services consulting, which was an increased amount. This is under the administrative expenses, to $100,000. And we reduced the in-house legal to 185. Did we do that at one? No, we kept that at the 185. That was the proposal in July.
The VNA.
And we reduced the VNA new program. That was a new program request for the community health education campaign from the $292,000 to the $150,000. So the results of that were 0.9122, which will produce a tax rate of $15,880,000, as opposed to the $14,000,004 for this year, and down from the $16,300 that would be was proposed in July. So I think that covers all of them.
Yes.
Okay. So now if there are,
I
Yes,
do
there-
just want to remind the trustees and also for the sake of the public here, we did change our final budget meeting to be the 27th of this month in order so that on the 25th, when we have our joint meeting with the hospital board to review the agreements with Cleveland Clinic, that we would have a better idea, a more solid idea of what the Cleveland Clinic agreement would be relative to indigent care. And so then we can adjust based on what our knowledge is at that point. We can adjust before the 27th for our final budget meeting. So we do anticipate that coming.
there was, I guess I did forget one, there was discussion around the school violence prevention intervention program, and I did we did agree at that time to leave it in for this time period, and Mary Beth and I did meet with the school district personnel, and I sent all those results out. There is some discussion around that. I would suggest that you hold off on that, knowing that if there is a reduction to that or a change to that number, that we do that next at the final hearing with the rest of all of the other reductions that you might make, given the hospital number and anything else, unless obviously you have others. I have not heard from you about many others.
I think between the hospital itself and the agreement with Cleveland Clinic and anticipated changes with the school violence program,
Right.
They're that both of those would be discussed and probably changed at the next meeting.
Okay.
But are there other comments now? Michael, you said you had some other,
Well, no, I had comments on the budget for the hospital. I thought the number we're having here is too high. But again, we have to wait until we really have an agreement with the Cleveland Clinic, so we know exactly where we're going to be, where we're going. And I think, as you say, that's an important part of the final arrangement. So we have to do that on the 25th.
yes.
And then after that, it would be prudent to go back and re-examine this.
Right.
And we could use this as a holding point for tonight's budget. But I just want to make my comment, I thought we were about $1 million too high on that number to the hospital. And when it came to the school safety program, my belief is that it will not, the last structure I saw was 9th grade, and I think that would not be very effective. And they talk about the programs that are existing, and I know we've heard a lot of talk about the programs that are in existence down south, all of which were marvelous on paper, were beautiful. The only problem is none of them were followed. From what we can see, there was a total breakdown and failure in government, and I'd like to know what program this school has to not fall into that trail, into those traps, and what effective programs they have in mind. I think you have to start much earlier than 9th grade. I believe that's not effective.
Well, just to speak to that a little bit, Anne Marie and I did go and visit, and we met with Mark Rundell and Ms. Torres, and got a better clarity as to what it was that they were asking for, I guess. And part of the request that they have in the new bill is that they must partner with community partners and to collaborate on these. So there's a number of community partners that are working with them on various programs relative to that. I think there was like 7 or 8 different people that have programs, and it's pretty comprehensive in there.
They do have a robust life skills program, which includes all kinds of offerings and curriculum for not only violence and safety, but mental health issues and how to care for your health and those kinds of things that are offered in the grade school, which are covered by, actually at 5th grade, that the Substance Awareness Council is picking up this year. And because that was being proposed to, and that's a transition area, and I described that in the notes that I gave you. Also, they provide for in the middle schools, so they do hit all of the grades and at a younger age for all of these programs in the public school anyway. And so that's why they felt like with 9th grade being another transition year into a bigger school, kind of a melting pot, all the schools come together, that it would be important to reiterate that and bring that program to that grade too. So they're not only offering it in 9th grade. I would hate for you to think they're not talking to these kids and teaching to the kids at a younger age, because they are doing it in grade school and in already, and we are not being asked to pay for that, and we are not, and others do contribute to that curriculum. So just for your information.
State programs that do deal with the very early childhood development.
That's right.
Yes.
And I'd like to see what we're doing with that. And also, another part of a whole school safety program would be security. How good is the security? What programs do you have to improve
And the school district
security at the district?
does have that in their budget. The part of the school district budget that covers that is they have now have a law enforcement officer at all of our public schools, and they pay for that, and they also have social workers and
Were those programs
psychologists.
voluntary, or were they mandatory they were mandated by the state? You know, I'd like to see the school district being much more proactive in school safety. We shouldn't have to wait for the state to tell us, knock on the door and say, you know, you got a problem. We should be ahead of that problem.
Well, one of the things that we did talk about with the superintendent, Mark Rendell, was that we need to be much closer to what it is that they are doing relative to mental health and that, so that we can work maybe better together on those type of things too. But we weren't aware of what they've got going, and I think we need to be a lot more aware of what they do have going before we probably.
And I do have the
participate.
school mental health plan in our office if you did not look at the copy we had at the last meeting. So if anybody wants to see that and how they're
I think the
implementing.
government entities should need to start working together on it.
No, they
right.
have to, it's a long-term problem.
That's what we should be doing.
And there are places where the problem has
Yes.
been solved to a certain degree. And why not go in and look at those models that we do know that are working and that have been successful. But this evening's discussion, really, this is going to be a point holder until we get the further information that we need from
Okay.
Cleveland Clinic.
Yes,
So I don't think there's, okay, that's fine. I
Okay.
don't see a problem with that.
okay. Is there, yeah, Anne Marie McChrystal, do you have any comments? Yes, can you hear me? Oh, yes.
Uh-huh.
Program. I have some thoughts about the school program, if you don't mind. May I?
Yes, you may.
All right. So basically, how does this differ from other mental health initiatives that the district is funding right now? And I don't know if there's question about the fact that it's in the school, but in the school, we have a captive audience. Now, I know the other programs that have been done are collaborating with other organizations in the community, such as substance abuse, etc. But when you have a captive audience of children that are vulnerable, many of them are vulnerable, 64%, I believe I read, are vulnerable children, but it's our children in the community. It's not a hit and miss that we do when we maybe refer somebody or somebody walks into a center or through the collaborative. We can reach that many more of our children that are transitioning from childhood to adulthood and who are going to be faced, these kids are going to be faced with critical choices. They're going to be making decisions that could be life-changing. I mean, look what has been happening all around our country. Isn't this mental health? Isn't that our charge as a health care community partner? Mental health is one of our biggest challenges in the community. To me, we ought to give this a go this year. I think it's very, very important to these kids that are going from 9th grade into high school and are going to be making a lot of decisions that are going to be very important in their lives. I comment.
Thank you. Any other comments from the trustees relative to this right now? Okay, any public comment relative to?
Of course.
My only comment is, Val Zudans, my only comment is about how this whole idea of your mission is creeping like crazy, okay? this started out that you're going to fund proven programs that were identified for benchmarks for healthcare, health indicators that were determined by the health needs assessment. And you're going to get in there and you're going to actually do only proven programs that showed a benefit and benchmarks in previously proven studies. This is way out of line. Okay, this is talking about this is the business of the school board, and half of our taxes for our community are going to our school board. They're responsible for these kind of things. It's getting way out of line. Okay, a lot of the programs that have come up before this hospital, the healthcare district, are not fitting with the whole idea of what programs are supposed to be. You could do a lot of really, really good stuff by focusing on those core measures: hemoglobin A1C, body mass index, infant mortality, and choosing programs that actually have been shown to benefit and measurably change those core health initiatives. This is not that.
Thank you for your comment.
Okay, so the proposal is leaving them in tonight, addressing and doing the reductions at the final public hearing, and if everyone is comfortable with that, we would be.
Public comment?
Oh, I'm sorry, I didn't see you, Sue.
You yes, absolutely.
Yep, there will be another when we propose the vote.
But she can talk.
Go ahead.
Come on, Sue.
Yeah.
Yes,
Yep.
yes. You can do either one. You don't have to walk all the way over there. You're good. Okay?
You're there now.
Hi, my name is Sue Tompkins, and I'm coming before you today as a taxpayer of Indian River County, but also as a volunteer at the VNA. And I want to thank you for your time in getting an understanding of the Vulnerable Village initiative that we've proposed. I want to make 3 really important points, and I'm going to come back to these 3. So let me just make them one by one. Number 1, as a taxpayer, I honestly have never felt that I had a lot of control over what my tax bill was going to be. However, I do believe what's far more important for this taxing district is to provide both qualitative and quantitative outcomes, results, and efficiency in serving the health needs of Indian River County. Secondly, as chairman of the VNA, we've seen significant changes in the leadership of our organization, and we are really entering a new era. The VNA is in a unique position because we serve thousands of patients a year. It's time that the VNA steps up to take a leadership role and drive healthcare outcomes in this community. Third, the stated mission of the hospital district is to foster a collaborative community healthcare system with the objective of improving the health of our community. There was a great deal of discussion in the budget meeting surrounding the care card and the funding of the indigent residents as it relates to the mobile unit. Although providing indigent care is important, the district's mission and purpose are so much more than that. In fact, the district's website does nothing but confirm the fact that their funding is not just for the indigent, but also for the ALIS population whose needs are real. With those 3 important points as a backdrop for my comments, I want to turn to the request for the Vulnerable Village Initiative. This is not your grandparents' mobile unit. It is a much more proactive, research-based, results-oriented, and comprehensive outreach program. It is a mobile unit that's reimagined in many, many ways. You all have seen the copy of the research that went into the development of this program. It is comprehensive. It includes primary care, screenings and prevention, collaboration with a wide range of healthcare providers and community leaders in the most vulnerable areas of the county, the inclusion of mental health screenings, a specific plan to refer patients to community health providers that are long-term providers of care and not duplicate services. A specific program for ER diversion and an initiative to expand the care card program. If that's not enough, we wrapped this entire program in with detailed outcomes tracking where we will follow 30 patients as part of a long-term study to really understand this population's behavior as it relates to healthcare and to track long-term outcomes. The data used to support this initiative is real. It has been tested not only in our community but across our country. Here's what we actually know today. A Harvard study of mobile units over a 6-year period shows that 20% of mobile unit visitors are diverted from the ER. In an initial study of our own mobile unit in August, if we take out school physicals, 34% of the patients receiving service on the bus in August were headed to the ER. The cost per visit on the mobile unit is $97. A visit to the ER is estimated to cost around $2,000. The Harvard study shows that on a national level, for every $1 invested in a mobile unit, the healthcare system as a whole in a community saves on an average $12. If we implement this program fully, the anticipated 3,000 patients served, if applying the average numbers, would result in ER diversion of 600 patients and a savings to the entire healthcare community of about $1.1 million. The collaboration with healthcare providers and village champions and leaders will allow for a global view of the healthcare habits and outcomes among collaborators and data which we have never had that can shape with the future of how we deliver healthcare in this community. I'm personally excited about this initiative as it goes back to my 3 original points: driving healthcare outcomes, being results-oriented, and collaboratively implementing to serve a broader segment of this underserved population. As excited as I am about the project, there are budget realities that I must also be concerned about. In developing this program, the VNA was planning to put in $100,000 to partner with the district, hoping that they would put in $292,000. The request for $292,000 is critical in order for us to implement all aspects of this program. Being the sole funder of the hospice house for the most part at the VNA and providing health care to our community without regard for whether those patients can pay or not, we have a shortfall in our budget for our next fiscal year that is significant. Our hospice house, many of you may not know this, our hospice house, just on an annual basis alone, costs us over $1 million over and above what we get in reimbursements. And we have to raise every dollar of that to support it. So I would respectfully ask that you consider a 1-year funding of the program at the requested $292,000. It will be the best return on investment that you will see next year of your dollars, and one that meets the district's stated mission of collaboration and improving the health of the community. The case is compelling, and you will have positive, quantifiable outcomes that you can report to your constituents, because at the end of the day, whether you save me $5 on my tax bill, I can tell you what I want to see from my district trustees is quantifiable, measured outcomes and results. So thank you so much for taking the time to look at our study and all the work that's been done on this, and for the VNA team that's here to support this initiative as well. I appreciate it.
Thank you, Sue. Comments?
So I'll go out on a limb for a minute. And again, the reason for tonight's placeholder of 9122 is that next month we can reduce that number, but we can't, or next 2 weeks from now, we can reduce that number. We cannot increase that number. So based on what Ms. Tompkins just presented to you, if you are compelled to put back in up to the 292 for that program, and or reduce any of the others next month, we know there will be a reduction in the hospital. So whatever that number ends up being, call it 500,000, call it $1 million, call it more than that. Whatever it is that happens there, you have that money to kind of shift your line items around, if you will, your reserve items around, if you will, and still have a really good chance of reducing that millage of 9,122. You may get really close to your rollback rate of 0.8445. I'm not saying you would be there, I haven't done the calculation, but I've done a lot of these calculations that take things out and put things in and moving around line items, which will keep you really close to, again, today it's an 8% increase. If you come down closer to that rolled back rate, you have 0 increase. I can't even imagine you'd go under the rolled back rate, but you could get really close to that and come to a 2% increase, for example, with some of your. So I just remind you that you're assessing a millage rate tonight and a tax rate, dollar rate that you can't go over. You can switch around your line items and talk about different programs and talk about different fees for service that you're paying for and still manage your reserve money that will bring your millage rate to a more manageable number if it's the millage rate you're focused on.
So can I suggest something,
Mm-hmm.
trustees? We have 3 distinct things that I think probably need to be talked about, okay? The VNA is one of them. For sure, the violence program,
Mm-hmm.
because we have learned some other things and there's maybe some other proposals, and rather than going through all that tonight, and then what we will learn relative to the hospital. We don't really have anything scheduled between the 25th and the 27th when we're going to vote on that. What I suggest is that we have a very specific meeting associated to those 3 items once we know what the big item is going
Mhm.
to be, so that when we do come in on the 27th, we can be very comfortable with where we are. I propose that to the trustees. What do you think about that?
Do you have a date that you're proposing
Well,
special meeting?
between the 25th and 27th,
Leaves you one date.
kind of gets you
on my
down to the
calendar.
26th, I think.
We have 2 meetings on the 27th, so.
We do
have
have,
two
yeah, but
meetings.
that was a specific request to be able to continue the discussion, if you would, relative to the partnership.
So we
I
certainly
don't think we
could
want to
have-
mix those 2 things. Right?
I would just vote on this now, the way it is.
Yeah.
Well, I think we would vote on this
But
the
I
way
think what
it
you're
is.
saying is this warrants more discussion even after the vote. Is that
I
correct?
think so.
Before the final.
Before the final vote?
That's, yes, because
I don't have a problem with
I think we have to
discussion.
have a discussion amongst ourselves around these specific items. And we can't really do that until we know what it's going to be reduced by, based on Cleveland Clinic.
Right.
For me to participate on the 26th, it would have to be a later in the day meeting, like 3 p.m. or later.
I'm completely flexible, so I can go by anybody else's schedule.
And it would be a call-in for me.
Can you do it?
It wouldn't be a call-in for me, but it would have to be after 1 o'clock.
Karen said 3 p.m. or later?
3 p.m. because the time I fly in and get to a secured location to make a phone call, it would be 3. Other than on the road, yeah.
I'm fine with after 3 o'clock.
4 o'clock? What's best for you?
I'm good at 3.
3 o'clock?
It's okay.
Anne Marie McChrystal, I don't know if you're hearing us, but are you?
I'm hearing you, but I'll tell you what, it is not easy with 2 or 3 people talking at the same time. What is the proposal? It had something to do with the 25th and the 27th.
Okay, the proposal would be that because we still have some things that I think, my own proposal is that we need some discussion on, and I think everybody kind of agrees with that, that after the 25th, when we are presented with the agreements relative to the Cleveland Clinic, but before the 27th, when we're going to vote on the final vote, that we would
Right.
have a meeting the afternoon of the 26th specifically for the budget to get ourselves comfortable on those three items. And,
I'm all there. I'm there.
I-
I'm there.
All right.
okay.
I am so there, okay?
So is 3 o'clock or 4 o'clock better?
3 o'clock
3
is
o'clock?
good.
3 o'clock is
3 o'clock it is.
3 o'clock on the 26th?
On the 26th, 3 o'clock on the 26th, specifically to discuss again the budget before the final vote.
Oh, that's wonderful. I love you guys. I really do.
And you'll be here loud and in person. But we do need to vote on this tonight.
Yes, we do.
We need to vote on this particular one tonight. So can I call for a motion?
To adopt first the millage rate of .9122.
Michael,
Michael moved.
may I hear a second?
Second.
Okay.
Discussion,
Comment?
public comment.
Discussion, comment, public comment? Yes.
Hi, good evening. I'm Jeannie Shepard, the Clinical Director for the Mental Health Association. I just wanted to make a comment regarding the proposal we were asked to do by the committee, by the trustees for violence prevention within Indian River County Schools. And one of the other public comments was about the focus of Indian River Hospital District funding and your fiscal responsibility to follow the healthcare plan. And mental health was a clear component of the healthcare plan. And I know that there is a lot of passion within the group of trustees and within our community to put the correct programming in place to ensure the safety, stability, and wellness of our schools. The one thing I want to say is I'm very grateful in the process that we were asked to put together a proposal, that we were able to go out to the schools. I was able to meet with principals, assistant principals, and direct care teachers at our high schools, and they were very grateful to hear that our community is looking at ways to support them as educators, because kids are bringing a lot more than books to school. There's a lot of issues that our kids are facing. And with looking at evidence-based practices, we've spoken to you on many occasions about the proposal and the life skills training. There is 12 years of studies regarding its efficacy, that it does have high treatment outcomes as an effective program for violence prevention. Thank you.
I believe there was just an article in the paper relative to that, too. So. Yes, sir.
Freddie Woolfolk, 4590 57th Avenue, Vero Beach, Florida, lifelong resident of Indian River County. I'm standing because I'm so happy to see collaboration moving forth. It's hard for a person who works in the daytime to make meetings like this, whether it's early in the morning, whether it's in the afternoon. So sometimes it takes a person like myself and others to come out and take the message back. Because when you talk about vulnerable communities, I live in one. I've been in it almost 67 years. That's a long time. So I look around me and see that these individuals who have the most deepest interests are not capable or are given the opportunity to come and stand before you as their fiduciaries in making sure that tax dollars are spent wisely. As I look at the amount that's been asked by the mobile unit, the BNA mobile unit, I feel that it's very critical that this particular project initiative, if you will, be supported wholeheartedly, not portion, not one-legged, not one arm, but wholeheartedly, because I feel that we present a wholehearted plan to people to see that we are serious. It's sort of like, do you want to build a home out of concrete, or do you want to put a mobile unit there? The mobile unit is good if you need a place to stay, but if you want to look at some permanency, whether it's going to be there for the long haul. And that's what the people in those vulnerable communities have faced when people bring temporary things in for a short time, 2 or 3 days a week, and then gone, see you, I don't want to be you. We gotta change that culture, and that culture we talk about quite seriously is the one that individuals have a tendency to use the emergency room as their first line of defense. We have to get the word out that we have a new sheriff in town, and that we're going to change that, go into those emergency room for those services, and we're going to have a VNA bus there, and we're going to see a change in the amount of people going to the emergency room. I served on a committee probably 25 years ago with the hospital. That's when Anne-Marie had black hair then. Long time.
Watch yourself.
Well, it's a long time ago, remember? You're talking about 25, 30 years ago. I served on a committee then, and we were talking about the same thing there, diminishing the use of the emergency room as a first line of defense. And believe it or not, I believe with this funding, full funding, I'm not asking any other program to be cut, but this program in particular, the VNA program with the mobile unit, is going to bring some stability, going to bring some permanency, but most of all, going to lessen that attendance at the emergency room. So I ask that you do consider it very seriously. I'm the chairman of the Gifford Health Council, and I'm here to speak on their behalf because that's their adamant decision that we got to do something that shows permanency and make a difference. Thank you so much.
Thank you.
Thank you, Freddie.
I vote for Mr. Wolford for new sheriff in town.
I second that.
My comment is on the financial side that, like Tracy Zudan said, because of increased property values, this hospital district, even if they kept the rates the same as last year, would have an extra $900,000. Plus, with the end of the partnership process, there's going to be about a $750,000 savings in costs to the hospital district. So that means there's $1.65 million that you guys have to work with. And I don't think that you should be raising, it's my opinion as a taxpayer, personal, that there should not be a raise in the tax rates over last year. You should work within your means, be good stewards of the money that the community has trusted you with, and I hope that you guys can do that. And I would encourage you not to vote to increase the tax rates over what we had last year. Thank you.
Thank you. Any other comment? Okay, then I will call for a vote of the millage rate, right?
Yes,
Okay. So, all in favor, should we do it one by one? Okay.
No.
Yes.
Michael?
Yes, as long as it's a placeholder and not permanent.
Yes.
Use a placeholder.
Yes.
Anne Marie McChrystal?
Yes.
Okay, and I vote yes. Okay.
Okay, now, you need to,
Call for a vote
motion for
on
the
overall
tax-
tentative budget of,
$15,880,904.
So moved.
I hear a second?
I'll second it.
Okay. All right, any comment on that? It's just same comments. Ditto, thank you. Okay, we got that. Okay, then I will call for a vote. Tracy?
No.
Yes.
Michael?
That's just a question. How is that different from the mill rate, the budget?
One
That
relates
mill
to
rate
the other.
produces that number, so if you assess the, right.
Relates to the other.
I guess I'm not in favor of the budget, but
It's a placeholder.
it's a placeholder.
Yes.
We can use it
Okay.
as a placeholder, okay?
So yes? Yes or no?
Yes?
Yes.
Anne Marie McChrystal?
Okay, tell me, because that blurred. What am I voting on right this minute?
You are voting on the dollars that relate to the budget that relate to
Right,
the
that's
millage you
fine.
just.
I vote yes. I vote yes.
Okay, thank you.
Oh my gosh. So I'm going to announce publicly that the percentage by which the new proposed tentative millage rate is more than the rollback rate is 8.02%. That's just an announcement.
Okay. All right, any other public comment? And we will have a meeting on the 26th at 3 o'clock to, again, discuss basically the 3 issues that we have that seem to still be out for discussion, okay? Any other public comment? Any other trustee comment? Okay, this meeting is adjourned. Thank you so much.